Good morning to all. Myself Manisha Bagane. Today's my presentation is pregnancy drug. Oxytoxins in obstetrics. Oxytocin, ergot derivatives, prostaglandins. First is oxytocin. Oxytocin. It is synthesized in the supraoptic and paraventricular nuclei of the hypothalamus. A half-life of 3-4 minutes and duration of action to approximately 20 minutes. Mode of action: receptor and voltage mediate calcium channels, amniotic and prostaglandin residual production. Next is indication: therapeutic pregnancy, early, to facilitate abortion, to stop bleeding following evacuation of the uterus, used as an adjunct of abortion along with other abortifacient agents. Late, to induce labor, to facilitate cervical repairing or for effective induction, augmentation of labor, uterine inertia. Continue. Indication in labor: inactive management of third stage of labor following expulsion of placenta perpedium, to minimize the blood loss and control the PPH. Diagnostic: contraction stage test. Principle: the test is based on the determination of respiratory functions of the feto-placental unit during induced contraction. CST. Candidate for CST: intrauterine growth restriction, post-maturity, hypertensive disorder of pregnancy, diabetes. Contraindications: compromised fetus, previous history of cesarean section, complication likely to produce preterm labor, APH. Interpretation: CST positive, persistent late declaration of FSR following 50% or more uterine contraction. Negative, no late declaration or significant variable declaration. Suspicious, inconsistent but definite declaration do not persist with more uterine contraction. Unsatisfactory, poor quality of recording or adequate uterine contraction is not achieved. Hyperstimulation, declaration of FSR with uterine contraction lasting less than more than 90 seconds or occurring more frequently than every 2 minutes. Next is oxytocin stimulation test. Procedure: interference. Contraindication of oxytocin: pregnancy, grand multipara, contract pelvic, history of cesarean or hysterectomy, malpresentation. Labor: all the contraindication in pregnancy: obstructed labor, incoordinate uterine action, fetal distress anytime, hypovolemic state, cardiac disease. Method of administration: controlled intravenous infusion. For induction in labor, use in labor. Intramuscular 5 to 10 units after the birth of the baby as an alternative to ergometrin. Adverse effect: maternal. Uterine hyperstimulation, uterine rupture, water intoxication, hypotension, antidiuresis. Fetal distress, fetal hypoxia and fetal death. Nurse responsibilities: assess intake output ratio, uterine contraction and FSR, blood pressure, pulse and respiration. Administer by IV infusion, monitor drop rate, make crash card available Evolution. Length and duration of contractions. Notify physician of contraction lasting over 1 minute or absence of contractions. Teach to report increased blood loss, abdominal cramps, or increased temperature. Ergot derivatives. Mode of action. Ergometrin act directly on the myometrium. Effectiveness. It is highly effective in a hemostasis. Indication. Therapeutic indication. To stop the atonic uterine bleeding following the deliveries, abortion, or expulsion of hydatidiform. Prophylactic against excessive hemorrhage following deliveries. Ergot derivatives. Contraindication. Prophylactic suspected fever, pregnancy, organic cardiac disease, several preeclampsia and eclampsia, RH negative mother. Therapeutic. Heart disease or severe hypertension disorder. Ergot derivatives. Preparation and pulse tablets. Ergometrin 0.25 mg और 0.5 mg एम्पुल्स में एंड टैबलेट 0.5 mg. मिथार्जिन 0.2 mg एम्पुल्स एंड 0.5 to 1 mg टैबलेट. Symptometrin 0.5 mg ergometrin plus 5 units of symptometrin ampoule, not operative. Onset of action route. IV ergometrin 14 से 15 सेकेंड लगते हैं एंड मिथार्जिन 5 मिनट. IM में ergometrin में 6 से 5 मिनट एंड मिथार्जिन में 7 मिनट. Oral 10 and mitargin 10 minutes. Ergot derivatives. Hazards. Common side effects are nausea and vomiting, precipitate rise of blood pressure, myocardial infarction, stroke, and bronchospasm because of vasoconstrictive effect. Prolonged use may result in gangrene, information of the lotus. Prolonged use in purpurium may interfere with lactation. Ergot derivatives. Cautions. Ergometrin should not be used during pregnancy. First stage of labor, second stage of labor, third stage of period to crowing of the head and in breech delivery prior to crowing. Nurse's responsibility. Assess blood pressure, pulse and respiration. Watch for signs of hemorrhage. Administer orally or IM in deep muscular mass. Have emergency card readily available. Evaluate therapeutic effect. Decrease blood loss. Teach to report increased blood loss, abdominal cramps, headache, sweating, nausea, vomiting, or dyspnea. Prostaglandins. Source. Electronic acid. Mechanism of action. PGF2A promotes myometrial contractibility. PGE2 helps cervical maturation. Prostaglandins used in obstetrics, induction of abortion, termination of molar pregnancy, induction of labor, cervical repairing prior to the induction of abortion or labor, acceleration of labor, management of ectonic PPH, medical management of tubal ectopic pregnancy, Contraindication of prostaglandins. Hypersensitivity to the compound uterine scarf. Preparation: tablet, vaginal suppository, vaginal pessary, prostin E2 and parenteral. Advantage: it has got a powerful oxytocin effect irrespective of a period of pregnancy. As such, it can be used independently, especially in the induction of the abortion with success. And later month it can be used for exhalations of labor. It has got no antidiuretic effect. Drawbacks: it is costly. Unpleasant side effect on systematic use are nausea, vomiting, diarrhea, pyrexia or bronchospasm. When used as abortion, extensive lacration occurs. Tachystosis. Methyl dopa. Mechanism of action. Drugs of first choice. Central and peripheral anti-adrenergic action. Effective and safe for both mother and fetus. Contraindication: hepatic disorder, psychotic patient, CCF. Dose: orally to 50 mg, bit may be increased to 1 gram TID depending upon the response. IV infusion to 500 mg. Methyl dopa side effect: maternal में postural hypotension, hemodialytic anemia, sodium retention, excessive sedation. Holmes test may be positive. Vitamin: intestinal ileus. Labetalol. Mechanism of action: combined alpha and beta adrenergic blocking action. Contraindication: hepatic disorder. Dose: orally 100 mg may be increased up to 800 mg daily. IV infusion, hypertensive crisis, 1 to 2 gram per minute until desired effect. Side effect: experience is less compared to methyl dopa. Efficacy and safety with short-term use appears equal to methyl dopa. Propranolol. Mechanism of action: with beta adrenergic receptor blocker. Contraindication: bronchial asthma, renal insufficiency, diabetes, cardiac failure. The drug is better avoided for long-term therapy during pregnancy. Dose: orally 18 to 120 mg in divided doses. Propranolol. Side effects: maternal, severe hypotension, sodium retention, bradycardia, bronchospasm, CCF, hypoglycemia. Vitamin: bradycardia and impaired fetal response to hypoxia. IUGR when began in first and second trimester. Neonatal hypoglycemia. Adrenaline. Mechanism of action: anterior vasodilator. Contraindication: because of the viable sodium retention, diuretic should be used. Dose: orally 100 mg per day in 4 divided dose. IV 5 mg bolus followed by 25 gram in 200 ml NS at a rate of up to 4.5 gram per hour to be doubled every 30 minutes. Side effect: maternal hypertension, tachycardia, arrhythmias, palpitation, Plepers-like syndrome, vital reasonable safe, neonatal thrombocytopenia. Nifedipine mode of action, direct anterior vasodilation. Dose orally 5 to 10 mg TTS. Contraindications: stimultaneous use of magnesium sulfate could be hazardous due to synergic effect. Side effect: flushing, hypotension, headache, tachycardia, inhibition of liver. Sodium nitroprusside. Mechanism of action: direct vasodilator. Dose orally 6 to 2.5. Side effect: maternal nausea, vomiting, fetal oligohydramnios, IUGR, fetal and neonatal renal failure. Nitroglycerin. Mechanism of action: release mainly venous but also arterial smooth muscles. Dose given as IV infusion 5 units per minute to be increased at every 5 minutes up to 100 units per minute. Side effect: tachycardia, headache, methemoglobinemia. Diuretics are used in the following condition during pregnancy: pregnancy-induced hypertension with massive edema, eclampsia with pulmonary edema, severe edema in pregnancy with heart failure, period to blood transfusion in severe anemia, as adjuncts to certain antihypertension drugs such as hydralazine or dioxide. Furosemide. Mechanism of action: act loop of the hand by increase excretion of sodium and chloride. Dose 40 mg tablet daily following breakfast for 5 days a week. An acute condition, parenterally 40 to 120 mg daily. Contraindication: hypersensitivity. Hydrochlorothiazide. Mechanism of action: act on distal tubule by increased accretion of water, sodium, chloride and potassium. It is used in edema and hypertension. Dose Parvola 25 to 100 mg per day. Side effect: polyuria, glycouria, frequency, nausea, vomiting, anorexia, rash, urticaria, real fever, increase creatinine, decrease electrolyte. Tocolytic agent: beta mimetics, prostaglandin synthetase inhibitors, magnesium sulfate, calcium channel blockers, oxytocin receptor antagonist, nitric oxide donors, antibiotics. Beta mimetics: commonly used drugs: terbutaline, retrotyne, isoxaspine. Mechanism of action: activated to the intracellular enzymes, reduce intracellular free calcium and inhibits the activation of MSK. Vitamimetics dose: retrotyne. It is given by IV infusion 5 units per minute and increased by 5 minutes every 10 minutes until contraction cases. Maximum dose of 350 units per minute may be given. Infusion is continued for about 12 hours after contraction cases. Terbutaline has longer half-life and has fewer side effects. Subcutaneous injection of 0.25 mg every 3 to 4 hours is given. Isoxaspine is given as a IV drip 100 mg in 5 days. Rate 0.2 units per minute to continue for at least 2 hours after contraction cases. Maintenance is by intramuscular 10 mg 6 hourly for 24 hours. Tablet 10 mg 6 to 8 hourly. Vitamin side effect maternal में headache, palpitation, tachycardia, pulmonary edema, hypertension, cardiac failure. Side effect hyperglycemia, ARDS, hyperinsulinemia, lactic acidemia, hypokalemia, and even death. Neonatal hyperglycemia, intraventricular hemorrhage. Endomethacin. Mechanism of action: reduce the synthesis of physis, thereby reduce intracellular free activities of MLCK and uterine conduction. Dose: loading dose 50 mg per oral or following by 25 mg every 6 hours for 48 hours. Side effect: maternal heartburn, GI bleeding, asthma, thrombocytopenia, renal injury. Next is calcium channel blockers. Nifedipine, nicardipine. Mechanism of action: nifedipine blocks and entry of calcium inside the cells. Compared to beta mimetics, effect are less. It is equally effective of GSFO. Dose: oral 10 to 20 gram every 6 to 8 hours. Calcium channel blocker. Side effect: maternal hypertension, headache, flushing, nausea. Magnesium sulfate. Mechanism of action: inhibition of calcium ion. Contraindication: myasthenia gravis and impaired renal failure. Functions. Dose: loading dose 5 to 6 gram IV over 20 to 30 minutes, followed by an infusion of 1 to 2 gram per hour to continue tocolysis for 12 hours after contraction have stopped. Magnesium sulfate. Side effect: maternal flushing, perspiration, headache, muscle weakness, pulmonary edema, rarely. Unit: lethargy, hypotonia, respiratory depression, rarely. Oxytocin antagonist. Atosibian. Mechanism of action: it blocks myometrial oxytocin receptors. Dose: IV infusion 300 units per minute. Initiate bolus may be needed. Side effect: nausea, vomiting, and chest pain. Anticonvulsant. First, magnesium sulfate. Mode of action: it decreases the acetylcholine release from the nerve ending. Magnesium sulfate. Side effect: magnesium sulfate is relatively safe and it is the drug of choice. Muscular paralysis, respiratory failure, renal function to the monitor. Antidote: injection of calcium gluconate 10% to 10 ml IV. Diazepam. Mode of action: central muscular relaxant and anticonvulsant. Dose 20 to 14 mg IV. Side effect: maternal में hypertension and fetal में respiratory depression, hypotonia और thermoregulatory problems. Phenytoin. Mode of action: centrally acting anticonvulsant. Dose 10 gram per kg IV at the rate not more than 5 gram per minute. Followed 2 hours later by 5 mg. Is epilepsy 300 to 400 mg daily, orally in divided doses. Side effect: maternal में hypertension, cardiac arrhythmias and phlebitis and at injection site. Fetal में fetal hypotonic syndrome. Anticoagulants, heparins. Mechanism of action: it inhibits action of thrombin. Dose 5,000 to 10,000 per unit to be administered parenterally subcutaneous. Low molecular weight heparin is 2000 to 500 unit. Side effect: maternal hemorrhage, urticarial thrombocytopenia, asthenia. Fetal is does not cross the placenta. Warfarin mechanism of action interferes with the synthesis of vitamin K dependent factors. Dose 10 mg orally. Side effect: maternal hemorrhage and fetal chondrial syndromes, optic atrophy, microphyle and contradysplasia. Analgesia and anesthesia in obstetric, sedatives and analgesic. Avoid analgesic and pethidine. Mechanism of action inhibits ascending pathways in CNS. Increase pain threshold and altered pain perception. Indication: moderate to severe pain in labor, postoperative pain, abruptio placentia, pulmonary edema. Dose: injectable preparation contain 50 mg per ml, can be administered subcutaneous IM IV. Its dose is 50 to 100 mg IM combined with promethazine. Contraindication: should not be used IV within 2 hours and IM within 3 hours of expected time of delivery of the baby. For fear of birth asphyxia, it should not be used in case of preterm labor and when respiratory reserve of the mother is injured. Side effect: maternal dizziness, confusion, headache, sedation, nausea, vomiting, fetal respiratory depression and asphyxia. Fentanyl mechanism of action inhibits ascending pathways in CNS, increase pain threshold and altered pain perception. Indication: moderate to severe pain in labor, postoperative pain and adjust to general anesthesia. Dose 0.05 to 0.1 gram IM. Side effect: dizziness, delirium, euphoria, nausea, vomiting, muscular dizziness, blurred vision. Fentanyl dose of 30 to 40 mg. Naloxone is an efficient and reliable antagonist. Adverse effect: neonatal respiratory depression secondary to the medication crossing the placenta and the affecting the fetus. Unsteady ambulation of the client, inhibition of the mother's ability to cope with the pain of labor. Tranquilizers: diazepam, usual dose is 5 to 10 mg. Midazolam, dose of 0.05 mg per kg is given intravenous. Combination of narcotics and tranquilized, butophenol and nalbuphine. Inhalation method: nitrous oxide and air, minimized nitrous oxide and oxygen, trichloroethylene, methylfluorine, isoflurane and enflurane. Epidural and spinal analgesia, effects, nausea and vomiting, inhibition of bowel and bladder elimination, suggestion. Bradycardia, tachycardia, hypotension, respiratory distress, allergy reaction and pruritus. Duodenal block: it consists of a local anesthetic such as duodenal block. It consists of a local anesthetic such as lidocaine or bupivacaine being administered transvaginal into the space in front of the duodenal nerve. Epidural anesthesia: epidural block consists of a local anesthetic bupivacaine along with the analgesic morphine or fentanyl injected into the epidural space at the level of the fourth or fifth vertebra. Adverse effect: maternal hypotension, fetal bradycardia, inability to feel the urge to void, loss of bearing down reflex. Spinal block. Spinal block consists of a local anesthetic injected into the subarachnoid space into the spinal fluid at the third, fourth, or fifth lumbar interspace alone or in a combination with an analgesic such as fentanyl. Head effects: maternal hypotension, fetal bradycardia, loss of the bearing down reflex. Paracervical block. It consists of lidocaine, xylocaine, inserted into the cervical mucosas early in labor during the first stage of block the pain of uterine contraction. Adverse effects include the fetal bradycardia. Improper techniques can result in serious toxic. General anesthesia: 100% oxygen is administered by the thigh mask fit for more than a 3-minute induction of anesthesia is done with the injection of thiopental sodium 200 to 250 mg as a 2 to 5% solution. IV followed by the platelet succinylmethonium 100 mg. The patient is intubated with sufficient PT tube. Anesthesia is maintained with 50% and 2 or 50% oxygen and at the Hydrothin. Fetal hazard on maternal medication during pregnancy. Mechanism of teratogenicity: folic acid deficiency, epoxide or iron oxide, environmental and genesis abnormalities, maternal disease and drugs, homboxgenesis. Maternal disease and drug homboxgenesis. Maternal fetal drug transfer and the hazard. Before day 31, teratogen produce an all or non effect. Day 31 and day 71. It is the critical period for organ formation. After day 71, the development of other organs continues. Placental transfer of drugs. The factors responsible for transfer are molecular weight than 1000 do not cross the placenta. Contraction of free drug. Lipid solubility, uteroplacental blood flow, placental solubility. Guidelines: if the benefits outweigh the potential risk, only then can the particular drugs be used with the prior counseling. Only when tested and repeated drugs are to be prescription and added to using the minimum therapeutic doses for the shortest possible duration. Maternal drug intake and breastfeeding. Transfer of drugs through breast milk depend on the following factors: chemical properties, molecular weight, degree of protein binding, iconic dissociate, drug contraction. Drug identified as having effect on lactation and the neonate. Bromide, raise thrombosis and poor feeding. Fluoride, neonatal hypothyroidism. Oral pills, suppression of lactation. Ergot, suppression of lactation. Anticoagulant, hemorrhagic tendency. Isoniazide, anti-DNA activities and hypotoxicity. Thank you.